Hello, my name is Nupur Shah and today we will see the topic called hamstring strain. In the previous video, we saw when does a muscle strain or a muscle tear happens. That was the video of classification of sports injuries. Under the heading of acute sports injuries, we saw muscle strain and the grades of muscle strain. So coming on to the same thing again. So when does a muscle strain occur? It occurs when the fibers will fail to cope up with the demand placed on them. Which are the main muscles which are injured, namely the hamstrings muscle, quadriceps muscles and the gastrocnemius, that is the calf muscles, because they are the two joint muscles. What are the grades? There are three grades, grade 1, grade 2 and grade 3. Grade 1 consists of small number of muscle fibers, there is no loss of strength and there is localized pain. Grade 2, tear of the significant number of the muscle fibers with pain and swelling which is localized and painful muscle contraction. And grade 3, there is complete tear and it is seen normally at the muscular tendinous junction. So under the heading of hamstring strain, introduction, commonest injury occurs among the sprinters, hurdlers or long jumpers. The sports in which the hamstring tears are common is hockey, football. In short, any high-speed runners are prone to get this type of injuries. It is seen commonly in the athletes in spite of regular stretching and strengthening programs. So even if the athlete is undergoing regular stretching and strengthening program, then also this injury is very commonly seen. What are the predisposing factors? The predisposing factors are age. As per age, the denervation of the muscle fibers will increase the risk of getting this type of strain. Then if there is previous history of some type of hamstring injury or groin or calf muscles are injured previously, then also this injury is very common. Then race, according to the research, this muscle strain is more seen in blacks. Lack of flexibility, lack of strength in the hamstring muscles will have more chances of getting such type of strain or a muscle tear. Then lumbopelvic instability will also have some impact due to the kinetic chain which will alter, and that is why hamstring muscle will have more strain or tear can also happen. And the last reason is lumbar spinal degeneration, especially at the level of alpha S1. How do we prevent it? Even prevention of sports injuries we saw in the previous video, and the factors which are responsible for prevention of sports injuries are, some of the factors are mentioned here. Number one is warm up, number two is stretching, appropriate training, protective equipment and appropriate surfaces. What are the clinical features for the hamstring muscle tear? It is sudden onset. The pain is moderately severe. Disabling level is the patient is not able to walk properly and in some cases is not able to weight bear at all because of pain. Then there is markedly reduced stretch. There is reduced strength of contraction against the resistance. There might be local hematoma. Marked focal tenderness is seen, slump test will be negative. Then there might be gluteal trigger points and have abnormal lumbar spine or SIJ signs, that is sacroiliac joint signs, because of which the pain is referred to the hamstring part, and there might be abnormal ultrasound or MRI if done. Management initially for first 48 hours it'll be RICE protocol, that is rest, ice, compression, elevation, and after that early mobilization, that is pain-free active extension while sitting whenever it is possible. This is the picture of pain-free active extension while sitting. Here the patient has to keep the back straight as much as possible. He doesn't have to slouch, and then he has to increase like he has to take the leg upwards and do the knee extension with toe dorsiflexion. In the next level he can hold this, and in the next level, that is after subsequent sessions, he can wear the weight cuffs and do the same exercise. What are the other part of the treatment? It is hamstrings and its antagonist muscles needs to be stretched. Then a strengthening of the hamstring muscles, both concentric and eccentric exercises has to be done. The neural stretch is also important, and finally spinal mobilization. This is the example of the neural stretch. The patient is in long sitting position, and to take the feet in dorsiflexion he is keeping some support so that the feet is coming into dorsiflexion as much as possible, and he is bending the neck passively, and holding it and bringing the thoracic spine and the cervical flexion with the hands. So this is the mural stretch. This is the digital ischemic pressure which is given to the biceps femoris tendon. If there are any tenderness at that particular point, then digital ischemic pressure to the biceps femoris tendon can also be given to break those tender points or trigger points. So this was the treatment of the hamstring muscle strain.